Didn't get into the room. I don't know why.
Well,
We are live.
yes. Good afternoon, everyone. Welcome to Ask the Doc with our health expert. I am Ines. I'm the communication specialist for African and Francophone here at CASA, and I'll be your host today. This live, we have started this live some times ago to answer your question, the question that you have to ask us a health expert concerning human and health services and resources available to you. Today, I have some great and amazing people with us here, and I cannot wait for them to answer the question that you have. In case you guys don't know, CASA recently won Baby Healthy Baby Act for you, and they are here to answer all those questions. Before we go any further, I want to clarify that this is by no means medical advice. These are general questions to answer your question. Without any delay, I'm going to give my guest, I meant to say, the opportunity to introduce themselves. Let me start with Ida. Can you please introduce yourself?
Thank you, Ines. Good afternoon, good evening, everyone. My name is Ida Etebenison. I am with CASA Health and Human Services Department, and I'm the lead community resource navigator. And I am happy to be here with you all this evening. Bonsoir à tous. Je m'appelle Ida Etebenison. Je travaille pour le département de la santé et des services sociaux de CASA et je travaille comme une navigatrice des ressources communautaires à CASA et je suis ravie d'être parmi vous ce soir.
Thank you so much, Ida. I'm glad to have you here. Cindy, can you tell us about you?
Hello, everybody. I am Cindy Colade. I work with CASA in Baltimore. I am the manager of the Health and Social Service Department for Baltimore and Central Maryland. Salut à tous, mon nom c'est Cindy. Je suis à CASA dans la ville de Baltimore et je suis la directrice de la santé et des services sociaux dans dans la ville de Baltimore et aussi dans les alentours, dans les counties des alentours. Merci.
Welcome, Cindy, and thank you so much. Walter, can you introduce yourself, please?
Hi, everybody. Thank you, Ines. My name is Walter Guzman. I work for CASA in the Health and Social Services Department. I am part of the hotline team. So, yeah. Mon nom c'est Walter. Bonjour à tous. Mon nom c'est Walter Guzman. Je travaille pour CASA dans le département de santé et services sociaux. Et je travaille avec l'équipe des gens qui travaillent sur la ligne de santé, la ligne téléphonique de santé.
Welcome, guys. Again, I'm your host. I'm Ines. I'm the communication specialist for African and Francophone here at CASA. And today I have the pleasure of hosting Ida, who's a navigator for the Health and Human Services, Walter, of course, and Cindy, who's located all the way in the Baltimore area. Guys, as I told you guys before, CASA won, or CASA member won Baby Equity Act. That's a great news. I want us to applaud for CASA member right now. It's such a great news. It's a milestone when it comes to health and especially immigrant advocacy in the area. But I have a question, guys. What does that mean? What does baby equity mean? I'm gonna open it to wherever want to take it.
Okay, I'll go ahead. Yes, the Healthy Baby Equity Act is a new law that was passed last year in 2022 that allows pregnant women who live in Maryland to apply for Medicaid regardless of their immigration status. And as you mentioned, this happens because of CASA members, CASA and its partner organizations. It was a hard battle, and we are here today to share the amazing news. They fought really hard for this new law to be passed, and it's a tremendous victory for the immigrant community. And under the Healthy Baby Equity Act, pregnant women can apply for health insurance, and they will through the program they will receive prenatal care and 4 months of comprehensive coverage after giving birth. So 4 months postpartum will also be covered under this new program. So it's an amazing victory for our community.
That's amazing. Before I ask if you guys want to add something else to what Ida say, Walter, we have a huge francophone community here at CASA. Can you tell them what it means? Let me translate what the question I just asked. Je disais que récemment, CASA a gagné la campagne qu'elle avait lancée pour ce qu'on appelle l'équité pour la santé des bébés. Euh, et c'est une victoire qui a été gagnée par l'aide des partenaires de CASA et aussi des membres de CASA. Et Aïda nous a expliqué ce que ça voulait dire, mais aujourd'hui, je vais donner l'opportunité à Walter d'aussi nous dire qu'est-ce que cela veut dire, qu'est-ce que cet acte-là veut dire et c'est quoi les implications de cet acte sur la vie des femmes ou des personnes enceintes en cette saison.
OK. Bon, le Healthy Baby Equity Act, on l'appelle d'une façon courte le Pregnancy Medicaid. C'est le Medicaid pour les femmes qui sont en grossesse, enceintes. C'est une loi qui était approuvée l'année passée par le Congrès de Maryland. C'était approuvé en juillet de l'année passée, mais ça a commencé à fonctionner cette année en juillet, le 1er juillet. C'est une loi qui, CASA et aussi ses partenaires, on s'est battu pour faire ces lois-là une réalité.
Okay. Merci beaucoup, Walter. Cindy, let me ask you this question. What are the requirements if a pregnant person today wants to apply for it? What are the requirements that they needs to meet in order for them to be eligible for this coverage? And so in short, who can apply for it?
Um, the requirements are that first have to be pregnant. So which will they will definitely need to go uh, to a hospital, and with the hospital, they will determine with a paper from a hospital would determine that they are pregnant, and with that, they will be able to apply for the healthy baby. Another thing is they don't need to have any type of immigration status, any status. So if they just came in, um, they just have to make sure that they have somewhere where they stay, because they also have to prove that they live in a state of Maryland. So they just have to have a proof of address and probably an ID from where they came from. So it doesn't matter which type of ID; they just have to have an ID with a picture and of course, the paper to say that they are pregnant, and also just an address to show where they live here in a state.
So the best way for people to know if they are eligible, I mean, the easiest way for them to know if they're eligible is actually to reach out to CASA Health and Human Services navigator so they can walk them through the process, I think.
Yes, so we definitely have the hotline, and we do have the hotline in all the languages. So in English, in Spanish, and it's French. So they definitely can call if they feel more comfortable in a French, and somebody will respond to them about it. And then we also do have a navigator that can help them make the application. In CASA, so they can definitely also call in somebody and make an appointment with them. But also, I would say that's the navigator is located in Montgomery. So I would say if they live, for example, in the Baltimore area and they still want us to help out, we do have we can they can come to our office and then we can make the call with them in case they don't feel comfortable with the language or anything. So we can definitely help them in French.
Okay, that's great. So the manager has spoken. She said you can either call, it doesn't matter which language you speak, French, English, Spanish, somebody will be available to help you. You can actually visit the website. It's in the comment section. Make sure you go and check it. But also, you can stop in one of the offices that have staff that are able and willing to help you in the process. Now, my next question is, when did enrollment begin? Yes, you said that the ads or the laws was won, the campaign was won last year, but when did enrollment actually begin, and when should people begin to apply?
So enrollment started July 1st. So July 1st, we it automatically started it, and the sooner the better. So the sooner somebody knows, the sooner that they know that they are pregnant, they can definitely come and apply for it. Um, and what was the other question? I think there was the two questions, right?
Yes, when did enrollment begin, and when should people begin
Yes.
applying? Okay.
So July 1st was the when it started it, and then as soon as possible, we want them to apply for it. Yes.
Okay. Let me get Walter to say it in French because we have a great francophone community here. Walter, je demandais à Cindy, j'ai posé deux questions à Cindy. La première question, c'est qui est éligible pour le Medicaid pour les personnes enceintes. Et la deuxième question, c'était de savoir quand est-ce que les enregistrements, les applications ont commencé. Si tu peux nous dire ça en français.
Oui, bien sûr. Bon, la première chose qu'on doit savoir, est-ce que la femme doit être enceinte. La deuxième chose, c'est important que la femme, euh, les femmes, les gens qui vont appliquer pour cette assurance habitent à Maryland.
OK.
C'est une loi qui est juste pour Maryland. C'est pas pour les autres États. Et puis, comme on avait dit au début, ça n'importe quoi. Quel est le statut des femmes qui veulent accéder à cette assurance? C'est important de dire que les, spécialement les femmes qui n'ont pas de papiers, pas encore, dans ce pays-là, sont bienvenues à appliquer pour cette assurance.
OK. Donc, je vais résumer ce que Walter a dit. Il a dit, premièrement, pour savoir si tu es éligible pour ce programme, tu dois habiter le Maryland, tu dois être enceinte et tu n'es pas obligé d'être légal ou bien d'avoir tes documents dans ce pays ici. Peu importe ton statut d'immigration, tu es candidat, OK, pour Medicaid. Ma prochaine question, my next question. Now, I'm bilingual, so I tend to speak different languages. My next question will be to Ida. Ida, what if someone gave birth before baby equity became a law, and they have unpaid medical bill? What will happen to them? Are they still eligible?
Okay, so before the Healthy Baby Equity Act became a law, pregnant women were also able to apply for a different program called Emergency Medicaid, It's not a health insurance. It's more like a health program that covers the delivery only, right? So prior to the Healthy Baby Equity Act becoming a law, people were applying for emergency Medicaid. So to answer your question, before the bill became a law, they could apply for emergency Medicaid. That was the only program available. Now, through the victory of the Healthy Baby Equity Act, they are not able to actually apply for health coverage, the pregnancy Medicaid, which will cover all the services. I hope that answered the question.
Okay. Before we continue, I want to tell all our viewers that you can drop your question. If you have a question pertaining to Medicaid for pregnant people, drop it in the comment section, and our expert will do their best to answer your question. Drop your question, drop your comments, drop your concern, and we'll direct you on we'll direct you to the right answer. Walter, can you tell us what she said in French for our francophone audience?
Ok. Bon, avant que la loi pour le Medicaid pour la grossesse soit approuvée l'année passée, il y avait un autre programme qui s'appelait le Medicaid d'émergence. Ce Medicaid d'émergence était, c'était un programme limité. C'était juste pour l'accouchement. Ce programme couvrait juste l'accouchement. Et bon, c'est pour ça que maintenant, ce programme, le nouveau programme, le Healthy Baby Equity Act, ou Pregnancy Medicaid, ou le Medicaid pour la grossesse, c'est une victoire pour toutes les femmes qui vivent en Maryland. Parce que comme ça, ils ne vont pas avoir peur d'accéder à des services médicaux pour ces grossesses.
Okay. Thank you so much. Cindy, I have a question for you. She's the manager all the way in Baltimore. So I have a question for you, Cindy. Is Medicaid for pregnant and for pregnancy and postpartum recovery, is it only for the length of the pregnancy?
So no, so it's not just for the length of the pregnancy, but it's also for 4 months after the birth of the baby. So after the birth of the baby, the mother will have the Medicaid. She will have the insurance for 4 months after.
Okay. So technically what you're telling me is that after the 9 month, once a person gives birth, they'll keep the Medicaid for up to 4 months. So it's
Yes,
gonna cover them, and I'm assuming the baby for the 4 month following the birth.
yes.
Okay, Walter.
OK. Et la question était
La question était de savoir est-ce que la couverture du Medicaid c'est seulement pour les 9 mois de la grossesse ou pour le temps de la grossesse ou ça continue juste après.
ça continue. C'est pas, ça couvre pas seulement la grossesse, mais le postnatal, 4 mois après avoir accouché.
Okay, merci beaucoup. I'm gonna open it to whoever wanna answer this question because I don't want it to just be one person. I want everybody. I want it to be to keep it interactive here. What is covered under Medicaid? What kind of health care can people access under Medicaid for pregnant and postpartum recovery?
Okay, I can start. I well, not that I think everything can be covered under it. Everything except vision, but the dental is covered. Um, The prenatals are covered. If they want, if they want to go for just a checkup on anything, let's say after the birth, if they want to go for a checkup that doesn't have to do anything with the pregnancy, it's covered. Um, I would say a little bit of everything is covered, but the vision. So if they want to do any checkup that they probably haven't done in a long time, they can take that opportunity to go and do so.
Okay. Ida, do you guys want to add, or Walter?
Yeah, it's really everything Cindy just mentioned. Under the Healthy Baby Equity Act, pregnant women are actually receiving a comprehensive coverage, right? Not only is going to cover the delivery or prenatal care or provide prenatal care services, they are actually going to be able to receive services 4 months after giving birth, right? It covers postpartum recovery as well. So under emergency Medicaid, they can go for doctor visits at no cost, receive free prescription. They receive mental health services, behavioral services. Um, I talk about prescription, and most importantly, they can also benefit from transportation services. So it's an amazing, amazing program. We cannot express how excited we are here today just to share the news with all of you and continue to spread the word and encourage all pregnant women who are in Maryland to apply for this program. Even if they are not sure whether they're going to be eligible, what documents they're going to need, please just give us a call. We have a group of people that are ready to answer your questions and help you apply to get your health insurance.
You guys heard the experts. Do not feel afraid to apply. You just apply. Don't ask yourself or question yourself, am I eligible or not? Just apply and let everything else work out in your favor. How can someone apply for this service now that you say, actually, let me get Walter to say the same thing in French, and then I'll ask my question because I have so many questions for you guys. Walter.
Ok. C'est important de dire que vous devez appliquer. Une fois que vous avez appliqué et vous avez été accepté dans le programme, et le programme, c'est gratuit. C'est complètement gratuit. OK? Et ça va couvrir des différents... tout ce que les femmes ont besoin pour les temps qui sont en grossesse. Et après l'accouchement aussi, les 4 mois. Tout est couvert par ce programme, ce nouveau programme-là. Spécialement les visites chez le docteur, et pour la santé dentaire aussi, et pour les médicaments, pour la santé mentale aussi. Puis, excepte, sauf la vision, presque tout est couvert par ce programme-là.
Okay. Okay, so let me recap what they just said because I love everything that is covered by this thing. And I wish it was out a long time ago, but we'll take it now. So they said that basically when you are approved for Medicaid for pregnancy and postpartum delivery, you get a comprehensive coverage. In that comprehensive coverage, you have doctor visits that are covered, you have dental care that is covered, you have prescription drugs that are covered, you have behavioral health care included, you have hospital care, lab work and tests, mental health care, and transportation included. I'm going to say it in French again because that's a huge package. I'm not sure if it can get better than that. Ce qu'il vient de dire ici, c'est que vous avez une couverture générale qui couvre plusieurs choses, hormis hormis la vision, c'est ça. Hormis la couverture oculaire, vous avez les visites chez les docteurs, vous avez les visites chez les dentistes, vous avez les médicaments qui sont aussi couverts, vous avez la santé mentale qui est couverte, vous avez les soins d'hôpital qui sont couverts, vous avez les examens d'hôpitaux et les tests, vous avez la santé mentale, je ne sais pas si je l'ai déjà dit, vous avez même le transportation, les services de transport, je crois, j'assume de l'hôpital jusqu'à chez vous, de chez vous jusqu'à l'hôpital, qui sont aussi couverts. Donc ça, c'est pas une petite assurance, ça, c'est quelque chose qui couvre beaucoup de choses. Donc, il faut vraiment prendre avantage de cette opportunité. So, guys, you have to take advantage of this opportunity because this is for you and it's for you that it was won. So don't delay it. I have another question here. I have another question to ask here. How can someone apply? Cindy, how can someone apply?
So the application, I would say, like I said before, they can call the hotline number, and then we can direct them to our person. We have one navigator that is that who does that. I'm sorry, who does that. So she will be able to do it, or they can contact. There's also the Maryland Health Department that they can check the site, and that they can contact them to do the application. I would say one, if they feel if they don't feel comfortable, they can also contact us in all the different CASA services, and we can make an appointment. They can come into our office, and the we can do the application together, because we are a third party. We just wanted to outreach to the community to let them know about this is happening. So we will help them do the application together on the phone, because the application can be done on the phone.
OK. Walter, la question était de savoir comment une personne peut appliquer pour ce service-là.
OK. D'abord, vous avez appelé la ligne téléphonique de santé pour prendre rendez-vous. Dans cette ligne, ils vont vous expliquer quels sont les documents que vous devez apporter, mais en général, ce sont 3 documents que vous devez apporter. Une identification, une preuve d'adresse et une preuve de revenu. Si vous êtes vous habitez chez un familier ou chez un ami et vous ne travaillez pas, vous ne vous inquiétez pas. On va voir la façon d'agir sur cette situation. La façon
OK. Thank you so much. Let me recap the answers that you guys gave me. Je vais essayer de répéter ce qu'ils ont dit. What Cindy, the manager, and Walter said is that for you to apply for these services, there are 2 ways that you can go about that. The first one is to go straight to the page, the Maryland page, and apply there. Or if you need help, you don't feel confident to do it by yourself, CASA has staff available and willing to help you. You can go to our webpage, we are CASA /Healthy Babies, and get the information there, or you can call the bilingual health hotline. For Spanish, the information is on your screen, but let me just repeat it here for the sake of repeating it here. You can call the CASA health hotline. For Spanish, it's the 301-270-8432, and for French, it's 240-270-1318. Call and they'll walk you through the process on how to apply. And Walter said here that what you need to have the moment you call is a form of ID, proof of income, and proof of residency. Okay? Ida, do you want to add something else?
Non, ils ont tout mentionné. Les documents qui sont nécessaires d'avoir, ce n'est pas vraiment compliqué. Tout juste de montrer une preuve d'identité, une preuve d'identité que vous êtes la personne que vous disiez que vous êtes, et une preuve d'adresse, tout juste pour vérifier que vous vivez dans l'État de Maryland, et aussi une preuve de revenus. Tout juste pour montrer combien vous faisiez par mois, par année. Une des règles, c'est de respecter aussi les revenus. Si vous faisiez un montant très, très élevé, vous ne serez pas éligible. Mais il ne faut pas s'inquiéter. Si vous n'êtes pas sûr, euh, comme tous mes collègues viennent tout juste de vous dire, appelez nous, notre ligne de santé, d'information, notre ligne d'information de santé, pour en savoir sur tous les documents nécessaires et fixer un rendez-vous avec une des navigatrices qui pourront vous aider à faire la demande. Ou soit vous pouvez tout simplement visiter le lien de l'État ou bien les contacter. Ils ont aussi leur numéro qui est disponible à la communauté. Mais nous sommes présents, nous sommes prêts pour aider toute personne qui se dirige vers nous.
Merci beaucoup. Thank you so much. We are at the end of our live, but before we go, I want to ask our navigators and our manager here if you guys have anything else to add.
Yes, I would like to add something in English. Um,
Sure.
in both phone numbers, you can have someone answering in English as well.
Okay.
Okay, the 301-270-8432. There is someone who is going to answer in English, and the other the French um, phone number as well. 240-270-1318.
Okay. Perfect. Well, it was a pleasure for me to host you guys for this August edition of Ask the Doc. I look forward to our next live. But for those that are watching us that have family members that have friends that are pregnant, I want to encourage you guys to share this live with them and tell them that we have we have broken the big secret for them here. They have the ability to be covered throughout the pregnancy and 4 months after the pregnancy, all throughout their postpartum recovery periods. So if you think that you might be pregnant or somebody around you is pregnant, call the hotline today and let's get somebody from CASA to help you in this program. Um, it was a great and it was such an honor to host you guys and learn from you guys on this big win. Congratulations to CASA for winning this, and I look forward to our next session. Bye until we meet again.
Thank
Bye.
you.
Thank you.
Bye bye.
Thank you. Salut.
Bonne
Bientôt.
soirée. Oui.